Kirsty Trigg suffers from a serious disease, schizophrenia, a neuropsychiatric disorder which affects about 1% of the population worldwide. Currently, the diagnosis of mental illnesses is only based on conversations and questionnaires. This could now be supported by a new low-cost blood test developed within the European research project SchizDX.
I found at times that I was listening to voices almost all the time, that I couldn't escape, that everyday things were just too big a challenge for me.
Hello. Hi Kirsty, good to see you. Take a seat.
The key problem of the diagnosis is that people who suffer from schizophrenia experience their symptoms so real they often don't really believe they're ill and therefore refuse any treatment. Researchers at the Department of Chemical Engineering and Biotechnology at the University of Cambridge have been working on a blood test for schizophrenia for many years. A first test was launched in 2010, but later withdrawn from the market as the price tag of around €2,000 was too expensive for wide usage. They have now developed a new version, which they claim is cheaper and provides more detailed information for the diagnosis. The test looks at certain proteins in blood samples of patients to distinguish between different kinds of mental illnesses. Researchers say that the new test is able to diagnose schizophrenia with a certainty of 83% and depression with a certainty of about 90%. Although the test could never stand on its own, it provides doctors and patients with valuable backup information. Sabine Barn and her colleagues want to launch the new test within this year.
I think this test would take away a lot of stigma from patients, because at the moment the problem is with psychiatric disorders, we believe it's all in the mind, and it's something which is quite abstract. But if a patient can also see in the blood, some abnormality, you can relate to it in the real world.
After 11 years, Kirsty was finally diagnosed with schizophrenia at the age of 31. Since she's got the right treatment, she's able to master her everyday life on her own and works part-time in a women's resources centre. Kirsty hopes that many of her fellow sufferers will be able to master their lives with schizophrenia as she does.
I know from my own experience, I think if somebody could have said to me, look, this is a biological illness that you've got, that there's a test for, that we can treat, and you stand a fair chance of recovery, that would have been fantastic.